Hello everyone, welcome to this lecture on enteric fever, that is typhoid and typhoid, and today we are going to discuss the salmonella and its pathogenesis. So then we are going to start with understanding the salmonella, then we will understand the differences between typhoidal and non-typhoidal salmonella, as well as we are going to understand the gastroenteritis and typhoid fever. What are these and the pathogenesis of the typhoid fever and how it is identified in the laboratories. So then first of all, what is salmonella? This is salmonella. Okay, so it is flagellated, of course, we can see, as well as it is rod shaped. Okay, so it is gram negative, short, flagellated rods. Okay, and they are facultative anaerobes and they ferment glucose. They do not ferment lactose. They are catalase positive. They are oxidase negative. And one most important thing is that they are cultured on McConkey agar. Okay, so all these points are very important. So all these strains are grouped in a single species, Salmonella enterica. Okay, and this Salmonella enterica can cause two very important diseases. First is the gastroenteritis, and second is enteric fever or typhoid. Okay, so we will understand these. First of all, let's see this that Salmonella can cause typhoidal as well as non-typhoidal diseases. Typhoidal is the typhoid fever and typhoid fever, and they are caused by the serotypes typhi and paratyphi ABC, while the non-typhoidal strains causes gastroenteritis. Okay, so first of all, the gastroenteritis is also known as salmonellosis. Okay, and the serotypes that causes gastroenteritis are enteritis and typhimurium. Okay, Typhimurium is one important one, okay, and they are non-typhoidal salmonella. Okay, so the gastroenteritis is characterized by the nausea and vomiting, the diarrhea, fever, and abdominal cramping. Okay, and these symptoms usually are occurs after ingestion of the contaminated food or water within 48 hours. Okay, and these symptoms are usually self-limiting. This disease is usually self-limiting. Okay, within 48 to 72 hours the patient becomes fine. Okay, of course we will take care of the diarrhea, fever, means we will give the symptomatic treatment to the patient. While the typhoid fever, it is caused by the serotype typhi, that is typhoidal salmonella, and it is an exclusive human pathogen, and it is transmitted by fecal oral route. Okay, the contaminated food is the usually the main cause, and it causes a severe life-threatening systemic illness which requires antibiotics. Okay, and it is characterized by fever and abdominal symptoms. So the typhoid fever is one of the very important cause of fever. If you will do your practice, then you will find that the typhoid fever is very common, and the knowledge of typhoid fever is very important to treat the patient. Okay, rationally, it is very important to understand this topic. So then let's see the pathogenesis. So pathogenesis is like this, that the salmonella, when you have ingested the contaminated food or water which contains the salmonella, it will reach the small intestine and it will invade the epithelial cells. And being a intracellular parasite, it will survive in the phagocytic cells. We will see this. And usually the disease remain localized but may become systemic and sometimes with disseminated foci. If it becomes systemic and with disseminated foci, then it becomes a complicated case. And here we can see that the ingested salmonella is here and it is entering by the endocytosis. And here are our first line of defense, macrophages and such as dendritic cells also. These are present in the submucosa and they phagocytosis the salmonella bacteria. And what happens then? Salmonella will enter the macrophages and macrophages carry the salmonella to the reticuloendothelial system by the portal pathway. Okay, and there in the reticuloendothelial system, bacteria will multiply intracellularly and it will cause lymphoid hyperplasia and hypertrophy of the liver. Okay, and usually patient recovers with a good treatment, but sometimes in 5% of cases patient may become chronic carriers. Okay, and these kind of patients usually excrete the bacteria even after 1 year. Okay, and the bacilli usually live in the gallbladder for months or years, and through this gallbladder they usually intermittently pass the bacilli in the stool most commonly. Okay, so stool will become one important cause of the bacterial infection to others. Okay, but less commonly it may also pass through the urine of the patient, of the chronic carrier patient. So here you can see by the fecal-oral route there is bacteria usually by the contaminated food or some water. It enters here and after 7 to 14 days of incubation period it will cause the addition to the mucosa and invade into the epithelial cells, and in the submucosa we know there are dendritic cells, there are macrophages. They will fight with these bacteria, but being an intracellular bacteria it will enter into them and grow there. And in the intestine there are Peyer's patches, one important region where they will grow, and they are mesenterial lymph nodes, and finally they will reach the reticuloendothelial system where they further grow, and from the reticuloendothelial system they may reach the gallbladder, spleen, liver, or bone marrow. And all these secondary infections are really very important to understand because these are the infections which may lead to severe complications and may lead to the reinfection. Okay, and severe complications include such as toxic encephalopathy with myocarditis and hemodynamic shock, but one very important one is the necrosis of the Peyer's patches which may leads to the peritonitis and sepsis. We will see this. So in the Peyer patches, there are some typical lesions. As you can see, it is an ileocecal lesion and there is an ulceration here. So there are ulcerations in the Peyer patches. They usually heal with time with the right or rational treatment. But sometimes they may not heal, and if it will not heal, then it may perforate, and if it will perforate then it may cause the peritonitis, a very severe complication which may lead to the sepsis in the patient. Okay, so it is a very important thing to know. These are the typical lesions in the Peyer's patches. Okay, so then how can we identify the bacteria in the patient? One important way is to isolate it from the patient's stools on the Mekong agar and grow it, and there we can see the Salmonella typhi bacteria, the flagellated one, small rods, these are gram negative bacteria, yeah. as well as we may collect some other specimens of the patient such as blood most commonly. Others are bone marrow or urine. We saw the stool. So all these specimens are appropriate for the right diagnosis of the typhoid fever. One more very important test of which you all must be knowing about, it is the Widal agglutination test, very commonly used. You all must have seen the Widal test in the prescriptions. Okay, so the Widal test, it uses a suspension of Salmonella typhi and Salmonella paratyphi A and B, which are treated to retain only O and H antigens of the Salmonella, and these antigens are kept to detect the corresponding antibodies in the serum from a patient suspected of having the typhoid fever. So if there are antibodies in the serum of the patient, and means the patient is suffering from the typhoid fever, and there are antibodies in the serum, they will react with the O and H antigens of the Salmonella typhi and paratyphi and will cause the agglutination, so the Widal positive. That's how we do the Widal test. For more such lectures, you can join me on Patreon. I will share the link in the description below. And I would like to recommend that to understand the reticuloendothelial system, please watch this lecture on the splanchnic circulation and reticuloendothelial system. So what knowledge we gained today? We know now that the Salmonella is gram-negative flagellated rod, and it may cause gastroenteritis and the typhoid fever. Gastroenteritis is caused by enteritis and typhimurium, while the typhoid is caused by the serotypes typhi and paratyphi A, B, and C. They survive in the phagocytic cells such as macrophages or the dendritic cells. They may cause typical lesions in Peyer patches where they may ulcerate and may cause peritonitis. The chronic carriers are those in whose the bacilli survive in the gallbladder, and the bacilli may pass intermittently in the stool of the patient. And how to identify the salmonella? We use blood culture or we may use Widal test most commonly. Thank you. Do subscribe, like, and share. You have an assignment. Please share where are O and H antigens located in the salmonella. These are the references. Thanks a lot.